Hey everyone, I'm Eric Christensen, pharmacist, BCPS, BCGP. I've had a request to cover the BCACP exam. Looking ahead, obviously, towards 2022. It's early 2022 when I'm posting this video. We have updated our study materials for the 2022 season. So those are ready to go at meded101.com/store, STORE. So you can certainly go check those out. My experience in doing this, in helping prepare candidates for these exams, I've taken pharmacotherapy, geriatric certification. I've taken those exams 4 times total between the two there. I have not taken BCACP, but I've definitely had some consultation with folks who have taken it. One individual I'd spoken with said, this was probably about 4 or 5 years ago, probably about 80% of what we have in our study package showed up on the exam. So I think we do a really, really good job. And we've obviously updated it since I had that kind of comment too about the percentage of overlap of the content there. We've had lots of time to update it over the years. We update it annually, trying to stay current with guidelines and critical new medication changes that kind of impact practice, that type of thing. We try to keep this up to date as best we can to obviously prepare you for these type of exams. And ambulatory care specifically, I've worked in ambulatory care practice, worked in a clinic type setting, so definitely understand some of the regulatory things and things associated there as well, which is obviously in our study materials. Anyway, let's get into the content outline and information about the exam. That's what you're here for. So, first off, this is a difficult exam. So, as you can see, the top one listed there, the pass rate is 64%. So, don't think you're going to come into this like the NAPLEX and you're going to pass it without an issue, okay? Pass rates of 95, 90, 85% plus aren't happening with this exam. And what I also remind people is that there's a lot of really smart people, that are trying to, be advanced in their profession and, get this certification. So, it's not generally the lower end historically students that have taken this exam. These are people that really want to stay up to date and current in their pharmacy practice. So pass rate is not very high. It is slightly better than some of the other ones, like cardiology and geriatrics. Those are 2 notoriously difficult. Usually BCPS is a little bit more difficult, I think, historically than ambulatory care. But a lot of that can change with the content outline. So if the content outline changes, then we maybe see a period of candidates struggling a little bit more where the study materials aren't as geared towards the newer content outline. So that can vary a little bit, but main point here, high failure rate. So it's okay if you don't pass. I hear from candidates, all the time that, are either asking about study materials or what should they do differently, that type of thing. I get those emails a lot. And it's okay. There's a lot of people that don't pass it the first time, okay? Now, with that said, if you're anything like me, it's like you want to prepare. You don't want to have to take it twice. But if you don't pass, it's not going to be the end of the world, okay? Now, financially, it's going to impact you a little bit. You got to pay for another exam and things like that. But it's not the end of the world. Your life's not going to be over. So just relax a little bit about that, because there's 1 out of 3 people, at least every time, are going to fail this exam. All right, so about the exam, the content outline did change about a year and a half ago. Obviously, we've updated our content since then, so we've tried to follow that closely. The exam itself, 175 questions, multiple choice. So there's one answer. Okay, so you're not going to get this select all that apply type thing, which can, oftentimes be a lot more challenging. Now, with that said, the questions can be difficult. They're asking you to select the best medication. And in clinical practice, you may have seen all of these drugs potentially used to treat diabetes or hypertension, but you have to decipher from the case and the patient-specific situation what the best medication or the best answer is going to be. So that's, a lot of the thinking with some of the case scenarios and stuff that you're going to get asked. Generic names. This is a question I get asked a lot as well. There's brand names, there's generic names, and from their content outline, they stick with traditional generic names. So that differs a little bit from the NAPLEX. All right, let's get into the content outlines a little bit. So first, we've got patient-centered ambulatory care. So that's primarily going to be pharmacotherapy with some caveats to that a little bit. Ambulatory care practice. So this is, like I said, my experience helps a little bit in working within a clinic type setting as an ambulatory care pharmacist, and then ambulatory care practice advancement as well. So let's cover those in a little bit more detail here. So first, the big one, patient-centered ambulatory care. So 75% of the exam, that's approximately 131 questions. Obviously, you're going to try to pay attention to this section. Okay, so from a pharmacotherapy standpoint, I say focus on weaknesses. So if you're a diabetes expert and you deal with that every day, you probably, or at least should be, up to date on what the guidelines are, what best practices are. You've probably dealt with cases all the time, day in, day out, in diabetes. And so you might brush through that section and make sure you're up to date and up to speed, that type of thing. But you're probably not going to spend a significant chunk of time on it. Now, if you never deal with anticoagulation, warfarin and apixaban and some of the newer agents and atrial fibrillation and dosing, in DVT treatment versus prophylaxis, that's definitely going to be a situation where you're going to want to maybe spend a little bit more time on that section. Okay. Now, the obscure things, I tend to tell people not to spend a ton of time on that. If you want to know the, top 1 or 2 or 3 drugs, maybe a little bit about the adverse effect profile, that type of thing. But, something like multiple sclerosis, for example. It's a pretty rare disease. It's kind of a specialized disease state. Could you be asked about it? Absolutely. You certainly could be. It's a big, broad content outline, and it doesn't say that it's not going to ask you about MS. But the likelihood that you get asked several questions about multiple sclerosis, the likelihood of that, I think, is incredibly low. So really focus on some of those big areas where we know there's lots of medications, lots of clinical quirks, lots of really spelled out guidelines, that type of thing. Now, thinking about the case-based questions, there's really 2 simple principles that I try to teach people. So what do I need to memorize about drugs? What do I need to know? And when you're reviewing cases and trying to decipher which medication selection would be the best, those 2 principles I think about is, okay, why would I use a medication? So that would be, guidelines and things of that nature, and why you wouldn't use a medication. So contraindications, drug interactions, all that sort of stuff. So those are kind of the 2 guiding principles that I use as I'm trying, or as I have tried to prepare for these exams. So spelling that out a little bit further here. So thinking about drug selection. So why you wouldn't select a medication? Well, if it's got a contraindication. So, using or a warning. So using an NSAID in a patient with heart failure. So if you see in the case that they've got heart failure, it's like, you should know we're probably going to want to avoid NSAIDs in this situation. Same thing with something like renal impairment or a GI bleed history. So kind of some good examples there with NSAIDs, for example. Now, compelling indications. So maybe you've got a frail, elderly ambulatory care patient. We're looking for a medication to help treat their depression. They note that their appetite's pretty poor as well. Well, you're probably not going to pick bupropion okay? But you might pick a drug like mirtazapine, which tends to potentially stimulate appetite more so than another antidepressant would. So those are the kind of things that you want to think about as you're reviewing a specific patient case. Other things that might creep up, obviously, adverse effect profile. So choosing a drug, patient says they have had trouble with medications and sexual dysfunction. Okay, and we're selecting an antihypertensive. So you got to know which antihypertensives may be more or less likely to cause sexual dysfunction. Major drug interactions, contraindications that way, of course, and genetic considerations as well. So allopurinol, carbamazepine, bacavir, kind of classic examples where we may do some genetic testing to determine if this medication is going to be tolerated there. Another frequently asked question, dosing. So do I need to know dosing? I would say not a great deal, but there are certainly specific instances. So think about anticoagulation. That's kind of the classic example I always bring up, where we've got differences between DVT treatment and DVT prophylaxis maybe. Okay. Another situation, think about warfarin. Okay, you should probably be able to appropriately adjust the dose of warfarin if you're going to be an ambulatory care pharmacist or a board-certified ambulatory care pharmacist. Okay, certain antibiotics, possibly if there's boxed warnings on certain meds, whether that be in a geriatric patient or something like that, those are situations where it might not be a bad idea to kind of memorize the doses there. All right, patient-centered ambulatory care. Like I said, it's not, I said this initially, it's not just about pharmacotherapy, okay? So there are some other things in the content outline. I would strongly encourage you, go to BPS Web, go check out the BCACP content outline for yourself. Now obviously in our study materials, we've gone through that and tried to include everything, but you've got to understand that there's more than just pharmacotherapy on these exams. Because if you don't know some of this stuff, or at least have an inkling as to what it is, you're really going to struggle. So thinking about, communication, prevention in ambulatory care, so prevention of certain disease states and preventing negative outcomes. Education, so like patient education, barriers, health literacy, lifestyle interventions, interviewing techniques. So kind of a classic one there is understanding what motivational interviewing is and how to apply that and what it looks like. Patient adherence, quality metrics, another example there. So, getting patients on statins where statins are indicated and things like that. So, knowing what these, a lot of these terms are, and again, many, many more than just this list here, but I just wanted to throw you out some examples. You've got to understand these terms, and you're likely to be tested on, or they certainly can come up on the exam because they're in the content outline. All right, so that wraps up the patient-centered pharmacotherapy ambulatory care practice section. Now we've got translation of evidence into ambulatory care practice. And this section is going to be primarily statistics and study design. Our stats study guide with our package, I think, does an excellent job. I've received that feedback from a lot of people, so I think we're right on the target there for sure. With some additions that I did this year as well too. So statistics, study design, if you don't know what ordinal data is versus continuous, if those two terms, you have no idea what I'm talking about, you have got to spend some time studying statistics, okay? So really make sure you know what's going on there. Study design, important as well, certainly. Population health, pharmacoeconomic principles, those are also found within the content outline in this section. But again, my primary focus here would be on the literature and study design and statistics that you see presented within that clinical literature. Again, this is 15% of the exam, so 26 questions. It definitely can make or break. And in my opinion, from my personal experience, the statistics questions are fairly straightforward. Again, my experience from other exams, and I've heard this from other folks as well, the statistics questions are pretty straightforward, but you have to understand terms and terminology associated with statistics. So you've got to spend some time studying that. And then lastly, we've got ambulatory care practice advancement. So here we get into a little bit of the alphabet soup, again, laid out kind of in our regulatory ambulatory care study guide in the PDF and the all access package. CMM, MTM, a lot of that terminology. Business models for ambulatory care practice. So are we, generating revenue off of CMRs? Are we generating revenue for a clinic based upon improving, quality metrics? Those different business models, again, I've laid that out in the study materials, but you've got to go through that and make sure you understand some of that, because you could certainly be asked about some of those models. Quality improvement things like PDSA and Six Sigma, again, definitely got to understand those terms at least, just to have a brief definition of what they are and what they mean and how they may be helpful in ambulatory care practice advancement. Educational strategies, so things like Bloom's taxonomy, that comes up on the content outline. Transitions of care coordination. So again, all these things we've tried to work hard to explain and lay out in our study materials, but it can be a significant chunk of the exam. And again, I've heard a lot of people being really, really close to passing, and this section certainly could make or break it with 18 questions within this section. So this is the MedEd 101 All Access Pass. So this is what's going to be included in there. So I got well over 20 hours of video review course. So again, your pharmacotherapy, your regulatory, everything on that content outline is covered within those videos. So if you're an Audible learner, that type of thing, and like to listen and watch slides, things like that, it's definitely helpful for you there. The slides are downloadable, so if you want to print them out, take notes, that type of thing, you're certainly welcome to do that there. Online question bank, so we've got over 1,000 questions in that, separated out by categories. Certainly we've got the answers and explanations. Both the video review course and the questions have been reviewed for 2022. With plenty of updates to the video course. There are over 20 videos we updated based upon guidelines and things changing and that sort of stuff. So in addition to the online question bank, we have 2 full-length practice exams. So this is a mistake that I've had people email me about, where they didn't get through the entire exam. And if you don't get through the entire exam, you get any question that you didn't get to, you get that wrong, and that counts against you. So whether you get study materials through us at MedEd 101 or somewhere else, be sure you practice questions and you're able to complete the exam in a timely manner. I recommend targeting a minute a question or less. That would be my goal as you're going through questions and practicing. Because at the actual exam, you might get frazzled on a question, you might get stumped, and you might, take a little bit longer than you think you're actually taking. So definitely take the time to prepare, and we've got 2 full-length practice exams that you can certainly check out, and obviously help time yourself from those to ensure that you're going to have enough time to get through this lengthy exam. Statistics study guide, it's a no-brainer. It's really, really helpful for folks, as well as the ambulatory care regulatory type study guide we have as well. So these are kind of separate PDFs within the package. Comparison tables, we've got some of them as well. So with this, you can get 1 month or 6 month access. So if you need a little cushion, you can spend a little bit extra and have that 1 year all access pass. Obviously, that gives you a little buffer too. So you don't have to repurchase in the event you wouldn't pass. Again, pretty high failure rate with some of these exams in BCACP specifically. And then over the years of creating this content, I have had other folks that have had study materials through maybe it's a friend or something of that nature. They've already purchased something, but they wanted the practice question. So this is something new within the last couple of years here. We've added the question bank only option. Now, your best value is to buy the all access pass for an extra probably $30 to $70. You can have 6 months or a year long access to the content, plus the additional PDFs and the 20 plus hours of review videos. However, if you've got study materials, you're comfortable with what you've got, and you just want to practice questions, that's definitely a good option that we have as well, where you get the 1 month and 3 month access to that content, depending upon how much time you've got before your exam. And that includes the online question bank, as well as the 2 full-length practice exams. So I've got plenty of testimonials from our content, me having an understanding of what these exams are like and how to prepare people for it over the last, it's been almost 10 years now that I've been preparing for these exams and preparing content to help people pass these exams. But plenty of testimonials, gracious people that have reached out with emails just thanking me for the content that we've put together in helping them ultimately achieve their goal of becoming board certified in ambulatory care. And then to find our content, meded101.com/store, STORE. If you've got a question, probably the social media platform I'm most active on is LinkedIn. So Eric Christensen, PharmD, BCPS, BCGP. Also track me down via email, mededucation101@gmail.com if you've got a specific question about these exams. I know it can be a little bit overwhelming for folks sometimes as they get into it. And I do consult with folks. It's something I've charged for over the years. So if you want, a half hour of my time, that is something I do set up with folks if, money's not an issue to you. So keep that in mind. That is something I have done for folks that are really, really nervous and would like a little peace of mind kind of in helping to set up their game plan in preparing for these type of board certification exams. So I'm going to leave links in the comments section. If you have any additional comments on this video, something that maybe you want me to cover in the future, certainly I'm open to looking at that if it helps some people prepare and helps them pass their exam ultimately. So hopefully this video was helpful. If you need anything else, don't hesitate to reach out. I appreciate you taking the time to watch.